Hello, everyone. It's a Good Friday edition of the Daily Tip. Really excited to launch a campaign. That actually is going to be one of the things that we're doing today. And my guest I'm going to bring in now is Sparky, who's calling in from Southport. He's on the source already.
I wish. Happy Easter.
Sorry to surprise you there. Cheers to everyone. So yeah, why don't we kick off, Sparky? You give a quick sort of who you are and obviously about Revitalise, a bit of backstory, and then we'll launch into the campaign as well afterwards. Yeah.
Yeah, absolutely. My name's Sparky, and I work at Sandpipers Revitalise in Southport, which is one of our 3 holiday centres, which provides holidays for disabled people, and we've been doing that for over 55 years. And we provide holidays with excursions, entertainment, activities, and we also have volunteers that come and support us as well. So we've been doing holidays for such a long time.
Cool. And obviously some people with that great intro of, where you work and the charity and what you do might well say, is that relevant at the moment with the fact that the whole country's on lockdown? So I think it'd be great if you could then sort of share there's some amazing stuff Revitalise have been doing around the coronavirus, hasn't there?
Yeah, we've had to adapt, like every business and charity, we've had to adapt. And what we're doing now is we're supporting, we want to support the NHS. So we have 2 centres down south, one in Southampton and one in Chigwell, forgot the name of the place then. And those 2 centres are going to be supporting the NHS. The patients that have been in hospital and are coming home don't have coronavirus. They'll be going to those 2 centres for some time to stay there. Our centre in Southport, however, is open for our guests or any disabled people who are struggling with their care support packages. So it might be that one of the carers that support them might have to be isolated, or a family member of that carer might have coronavirus symptoms. So that really does worry quite a few people, especially around their support of the care around them as well. So it is quite important that there is somewhere for them to go to feel safe and feel cared for, and that's what our centre in Southport is open for.
Yeah, and I think that's such a great. It's obviously from the Revitalise perspective of there's no holidays that you've been doing for 55 years. There's the 3 centres. There's all that the care staff and all the expertise of that, and then a kind of how can you help within this national, it's global crisis, but obviously within England, within the UK, how can you help? I think that's a fantastic way of trying to offer that support. And then from the other side, I have a care team, so I know I've spoke to Andy and Louise, who also work for Revitalise, because I've done that bit on the BBs about my fears and concerns. And I have to say, in the first instance, I wouldn't imagine going away to another centre would be in my way of thinking with everything at the moment. But actually, when you break it down, it's about a backup as well. So it might be right now that lots of people are fine, and fingers crossed that they stay healthy and their care team stay healthy. But if my fiance and my care team that come in every day were to get the virus, I would be very vulnerable and exposed in that situation. And I think it's amazing to know there are other options. And so I wrote an article on Disability Horizons where I was talking about the worry and also some of the potential solutions. And there might be another person that can then slot in the care team, and that's great as well. But I think it's just really good to get the community to just think about what is their sort of plan B or plan C. So what you mentioned on the NHS side, the 2 of the 3 centres are going to be supporting the NHS. So could you just explain a little bit more about that, how that's going to work?
Yeah, so they're going to be open for patients that are leaving hospital around those areas where the centres are. So that's Southampton and Chigwell, London area. So when they leave the hospital, that will free up beds for the hospital to support people with COVID-19. So that means that we take those guests, or sorry, those patients from the NHS who don't have COVID-19, and they've got somewhere to isolate if they need to, or be safe, really. So we take those to free up the beds for the NHS. That's what our role will be.
No, that makes sense, doesn't it? That obviously if someone's better, like, well enough to not be in a hospital when those beds are needed from other people that are in a newer level, if you like, of having COVID-19 and need a lot more support, but those people that are recovering still are not able to just go back to full independent life. It's great that your facilities can help those people and free up those beds. So that's a fantastic initiative.
Well,
and then in terms of with the where you are in Southport, which, as I was mentioning to you before, I've briefly visited a few years back, not the centre, but we were in the area and we went to the beach at Southport. So could you just tell us a little bit about the centre in general, like the kind of provisions and services that are there?
Well, normally what we would have with our holiday experience, we'd have entertainment and activities, and we'd have a bar. We have a bar. We've got a swimming pool there, and lots of different things that are going on, like excursions and things like that. But obviously, we won't be operating that as such. So what it'll be is a safe place for people to isolate if they want to self-isolate, and feel that they've got the expertise and the knowledge from our care staff team and our nursing team to feel supported in this really, really quite stressful time.
No, it's amazing stuff. And I definitely hope, as you say, like if things should go that way, it's great to know that you're there during COVID-19. And if I don't have to deal with anything that dramatic during that time, it's also somewhere I'd love to come and see afterwards once all this has passed as well, because it sounds like a great place. There's a lot of good stuff been going on there for a while. So just in terms of that plan B, and if someone was to need that sort of backup, how would that work if someone suddenly finds they're in a bit of a sticky situation?
Okay. Well, if they contact us directly through our Revitalise website, or through our Facebook pages, or on our telephone number, which will be through the website or through a link here with your magic, what we'll be able to offer is transport to Sandpipers in Southport. So wherever you are in the UK, we'll be able to offer transport. Transport will be available, and we'll also be able to offer some funding as well. So if you're worried about funding, come and speak to us, and we'll be able to sort something out for you.
That's great. Yeah, because I know that's obviously another factor, isn't it? That some people, I know on one side that you, as a charity, there is generally sort of financial support to make the holidays more affordable as well. So it's when it's business as usual, it's still very good prices. But I understand it's there's even more of a lower price for the particular situation. And then even within that, if there are difficulties with money, it's great that you can actually offer that support. What's the URL, please, Sparky?
It's www.revitalise.org.uk.
Yep. Revitalise.org. I'm still getting my head around all this tech stuff, but I think we can get that to scroll up now.
Oh, wow. Brilliant.
The power of technology. So have you got anyone at the moment staying with you?
We have about 10 guests, or residents, if you want to call them that, staying with us, self-isolating. And it's not a holiday situation, so it's not fun.
No,
it's nice for them to interact with people as well, because I self-isolated for 14 days 2 weeks ago, and I found it an absolute struggle because I like to talk to people, and I'm only talking to the dog. I'm not getting anywhere with that. But it's really hard being in a situation where you cannot go out. Absolutely, really quite mentally draining, I found. But now I'm out of that, and I can speak to people at work now. It's great. It's lovely. So I think if you are worried and concerned that you're going to be on your own, well, you don't need to be. So contact us, and we'll offer support with funding and transport to get to Sandpipers. That's what we'll do.
Brilliant. Well, as I mentioned, we're live streaming to Facebook, LinkedIn, YouTube, and Twitter, and we've got quite a few likes and hearts coming in. And there's we know people are watching. We haven't had any direct questions at the moment. We've had one comment, and I'm presuming Kim knows you. Is that right?
Hi, Kim Kemp.
So I'm judging by the fat Sparky with lots of exclamation marks. She's met. Have you met her before?
She must have met me somewhere.
Yeah.
I'll tell you what, I have.
So that's Kim. If you're still watching, Kim, let us know if you've met Sparky and when, and if you've had any interaction with Vitalize. I say, anyone watching, it doesn't have to be a direct formal question. It can just be some, thoughts on what we've been talking about, and it might be that you've stayed with Revitalize in the past, and just let us know what your experiences are. So I can also say that from Disability Horizons involvement with this, so obviously we're having the chat today, and we've done the article, which I'll link to afterwards, to really frame everything that's going on. And what we want our community, or the general disability community, to do is just to, like you say, Sparky, to not feel isolated or worried about what ifs, but to know there are options, and to think about that, rather than sort of push it away and then find that if, excuse my French, the shit hits the fan, that they then have to worry about it. It's good to have a bit of planning and thinking in advance, so you know what to do, and just to know there are lots of options. And also we've got a hashtag COVID care plan. So that's for people to, what they've already thought about, or maybe after watching us today, Sparky, they'll start to have a bit of a thought, and they'll, feel free to share really what their backup plan might be, whatever that might be. But just to know you're not alone. And I think what you said is really important, Sparky, about that the country is feeling, it's called self-isolation. We're being isolated, and it has a big impact on mental health. And so there's potentially, for someone that is on their own, maybe all the time, but having care dropping in and out, it could be a great way of also having that a bit more of not the party side of it, but a bit more human contact as well.
Absolutely, definitely.
So we've got Rich. Good afternoon, Martin and Sparky. Hello, Rich. Good to see you again. Rich is working on an app where disabled people rate it, to sort of help give that community verification of places that have gone above and beyond for access. So good to see you there today, Rich. And we've got Andy. These snippets of reality that is going on every day is good. Thank you. So Andy, basically for many, many years, I've had my Motability car, and Andy has always been helping out with doing the servicing and keeping me on the road. And I know he's been spending more time with his grandkid and all the rest of it, but nice of Andy to join us. And as he said, it's even doing this kind of thing online, it's that bringing people together and having that sense of community is really important as well.
It is. It's really important. It is important. I've been doing some Facebook Lives on our Facebook page, Revitalize, over the last couple of weeks, doing quizzes and bingo and discos and things, just from your little bedroom. But no, it's fun.
It's a way of connecting with people from from your side and from the community side, isn't it?
Definitely.
How did you? I mean, it was quite interesting. I've seen various things popping up with virtual events. How have you found running those Facebook lives, and how have people reacted with those as well?
Well, I've enjoyed it. I did a fancy dress disco the other night. That was good. The only problem is Facebook. I think they were a bit interested in what I was playing at the time, and they kept cutting me off. But at the end of the day, it was a bit of fun for everybody, so that's doesn't bother me. But no, getting lots of interaction. That's what I like.
That's perfect. That's perfect. Well, there's one more comment coming in. I was going to say, anything else you wanted to mention? I'll pop the website up again for people to come and check out more about Revitalise, and particularly, if that's not a potential Plan B option, there's obviously more information, and there's people that can answer further questions, right?
Absolutely, yeah. There's a section on there that asks about finance and what's expected if I come to a centre. So have a look at that. There's also updates on the COVID-19 as well. And you can see pictures as well. If you want to see what Sandpipers looks like, then have a look there.
Great point. Yeah.
It's you meet the team as well, so it's quite easy to navigate.
That sounds really good. Yeah, well, definitely anyone watching, and obviously some people will watch this later on as well. So if you're watching it not live, but still feel free to comment and to check out the Revitalise website. So Richard said, either of you watched Crip Camp on Netflix? Any thoughts? Have you seen that Crip Camp yet?
I've watched Tiger King. Not that.
I've heard some crazy things about that. Yeah. So I don't know, Rich, if you go back probably a week or more, I did a video review of Crip Camp. It might actually be 2 weeks ago. I've lost all sense of what day it is now, Sparky. But my review was exactly. So but yeah, Rich, if you have a look, there's definitely a lot going on that's worth watching on Crip Camp. I thought it was very good. For you, Sparky, anyone not watching that hasn't watched it, it was all about the sort of the disability activism out youth camp in America, and they went on to get the law passed for disability rights, and it was a really interesting documentary. So I don't know if you've watched it or not, Rich, but yeah, I definitely would. Yeah, jot that one down.
Jotted and circled.
And Andy said if you contact Facebook, they will relax the controls on your site.
Okay.
So yeah, I don't know. That's good to know.
One for Louise and Andy.
Thank you very much.
Thanks, Andy.
Yeah. And Rich has just said, I'll find it. I found it interesting and motivational. Yeah, definitely. I would recommend Crip Camp.
Cool.
Well, I think that probably draws us to a bit of a close. I say, is there anything else you wanted to add, Sparky, before we go?
Just to add that, we're really proud to support the NHS in this really difficult time of the crisis. And that Sandpipers is open to people who feel socially isolated, really, and need that support, especially if they're worried about the carers not being well enough to come and support them. Then, come and speak to us, come and contact us, and we'll support with finances and with transportation getting to Southport.
Brilliant. No, thank you for that sort of summary of everything. And from my side, thank you for reorganizing things so appropriately to help disabled people and people in the hospitals during obviously a very challenging time. And keep doing all the fun Facebook lives. I'm going to check out some of them now myself.
Cool.
It sounds like a lot of fun. And yeah, obviously we're all hoping that we'll be back to more normal times, and the holiday aspect will open up again, and anyone interested in that for whenever that's appropriate, obviously do check out Revitalise for that information as well.
Yeah, definitely. Keep in touch, everybody. That's what it's all about.
Thanks. Definitely. Well, thanks for watching, everyone. Enjoy Easter weekend. It's a Good Friday, even though it feels like most other days the last 3 weeks, but Have a great time, whatever you're up to, and we'll see you again for another episode of the Daily Sib next week. Take care.